The program that's being honored is the Metropolitan St. Louis Pandemic Task Force. That was a group that formed at the beginning of the COVID pandemic that brought together the health systems of the region with the public health officials and elected officials, as well as representatives of the business community. The purpose was to try to coordinate how we responded to the challenges that the COVID pandemic put in front of us.
The response has been unique in the cooperation among the region's public health departments with hospitals and healthcare systems, schools, and the business community. The pandemic has been something that none of us were really ready for. There was no book we could check out at the library on how to respond to it. We sort of had to go forward and do the best we can.
We knew that our large health systems were all going to be challenged to be able to manage the demands in front of us, and thought it would be a good idea if we shared ideas and came up with a joint strategy. It was a unique collaboration at the time, and I think is one that still stands out in terms of public responses to COVID. The things that made this collaboration work especially well was the clarity about what each individual stakeholder brought to the table. The health system served as an unbiased observer of what was happening, capitalizing on their expertise in infection prevention and understanding disease patterns in the community.
These local public health departments that are not regularly staffed for such enormous tasks have worked tirelessly managing public health issues that span the need for public education, large-scale vaccination distribution and administration, unprecedented case investigation, contact tracing, and isolation or quarantine orders as needed.
The government agencies involved, the public health offices involved, had the capability of implementing social controls and other measures that were going to be essential to containing the epidemic at the onset.
The people on the ground, the people in the departments were constantly talking to each other, exchanging information, trying to help each other. I think together we accomplished a lot more than any of us would have working solely by ourselves.
The other sponsors in the group, business community, members from the Federally Qualified Health Center, were also very important in helping to shape opinion and get endorsement to the whole idea. None of us went into it with an eye towards getting rewarded or recognition for it. We really went into it with the idea that the healthcare system was under serious threat, and that if we didn't take steps, we could compromise healthcare for the entire region. So getting this is really icing on the cake. It's a very, very pleasant surprise.